Pelvi abdominal mass. A woman with a pelvic abdominal mass can present with various symptoms that can be classified as menstrual, urological, bowel, or pressure-related symptoms. They can also be asymptomatic and diagnosed incidentally. When a woman presents with a pelvic abdominal mass, the two key issues are: 1. Where does the mass come from? 2. Is it benign or malignant? Pelvic abdominal mass can be found in gynecological organs, namely the uterus, fallopian tubes, ovaries, or in non-gynecological organs such as the bladder, bowel, or kidneys. A good and thorough history is essential as it will help to narrow down the differential diagnosis. Let us take a closer look into the symptoms in presenting complaints and associated history. The most common abdominal swelling in a reproductive age woman is pregnancy. Pregnancy should be ruled out at the start of medical investigation. Persistent abdominal distension or swelling of more than 2 weeks in a non-pregnant woman is usually associated with a pelvic tumor, such as ovarian malignancy. There are many possible causes for acute or chronic pain. Investigations into the following aspects should be undertaken for the diagnosis: site, onset, character, radiation, alleviating factors or associated symptoms, timing, exacerbating factors, and severity. Possible causes of acute pain include ectopic pregnancies, pelvic inflammatory disease with tubo-ovarian abscess, when present with fever and foul-smelling vaginal discharge. Cyclical acute pain can be an indication of endometriosis and endometrioma or adenomyosis. In chronic pain cases, cyclical pain may be due to long-standing endometriosis and endometrioma. A tubo-ovarian abscess and previous history of pelvic inflammatory disease may cause chronic pelvic pain. Pressure symptoms may be caused by a mass or growth pressing on other organs. When that happens, it can cause urological issues like frequency of micturition or voiding difficulties, or if the mass is pressing on the bowel, it could cause constipation or bloatedness. General heaviness is experienced in the abdomen or pelvis. Menstrual dysfunction is classified under 4 symptoms: heavy menstrual bleeding, postmenopausal bleeding, intermenstrual bleeding, and postcoital bleeding. Heavy menstrual bleeding could be caused by the presence of fibroids, while irregular menses in a premenopausal woman or postmenopausal bleeding could be a sign of uterine malignancy. Intermenstrual or postcoital bleeding may indicate a pelvic or vaginal infection, and if associated with a pelvic abdominal mass, it may be more likely to be a tubo-ovarian abscess or hydrosalpinx. Postcoital bleeding may also be a sign of cervical cancer and should be ruled out during investigations. Clinical examination may range from physical to clinical or laboratory tests. Let us take a closer look at these processes. General examination is important, in particular looking for pallor, breast lumps, any palpable lymphadenopathy, or lower limb edema. There are 3 types of abdominal examination: inspection, abdominal palpation, and specific test. During inspection, take note of the presence of scars to help in predicting the difficulties of future abdominal surgery if required. Abdominal distension can be caused by the following 7 F's: fat, fluid, fetus, flatus, feces, filthy big tumors, or false pregnancy. Also, look out for local or general abdominal swelling, for example, surgical hernias, prominent veins, pulsations, and skin lesions. When conducting abdominal palpation, check for guarding, rigidity, and rebound tenderness, which can signal the presence of an acute abdomen. Also, palpate for intra-abdominal mass and enlargement of other organs, example, hepatosplenomegaly or inguinal lymph node enlargement. Specific tests can also be done to determine ascites, shifting dullness, or fluid thrill. Palpation can be conducted to check for supraclavicular node enlargement. For any abdominal mass, the following should be determined: site or region involved, tenderness, size must be measured, and shape, surface, regular or irregular, edge, regular or irregular, consistency, hard or soft, mobility and movement with inspiration, pulsatile or not, whether or not you can get below the mass, which indicate this is most likely a pelvic mass. The components of a pelvic examination are inspection, speculum examination, and digital vaginal examination. Inspection of the external female genitalia is important prior to proceeding to speculum and vaginal examination. If skin discoloration or pigmentation is cited, the conditions could be leukoplakia or lichen sclerosis. Redness, swelling, or excoriation are signs of infection, and the presence of lumps or bumps could be caused by ulceration, warts, or vulval abscess. Check if vaginal discharge is purulent, clear, or blood-stained. Check for stress incontinence and uterovaginal prolapse. During the speculum examination, check the presence and nature of vaginal discharge. Appearance of the cervix for cervical atrophy, cervicitis, cervical polyp, Nabothean cyst, cervical ectropion, and cervical cancer. Lastly, check the appearance of the vaginal walls for atrophy, vaginitis, vaginal lumps or lesions. Vaginal examination involves assessment of the uterus, cervix, and vaginal fornices. Bimanual palpation of the uterus allows for assessment of its size, shape, mobility, anti- or retroversion position, tenderness, and consistency. The cervix normally points towards the posterior vaginal wall. Note the position, size, shape, consistency, tenderness, including cervical excitation and mobility. Vaginal fornices. There are 4 vaginal fornices: anterior, posterior, left and right fornices. This will allow assessment of the adnexa and parametrial area, as well as further assessment of a pelvic mass. Rectal examination is an important part of a physical examination, especially if malignancy is suspected. The rectal exam will allow for the assessment of the pouch of Douglas. A urine pregnancy test should be performed in all women in the reproductive age. There are 2 types of diagnostic imaging that can be performed: pelvic ultrasound and the CT scan. Pelvic ultrasound scan is the most sensitive radiological investigation in the assessment of a pelvic mass. Specific features on a pelvic ultrasound scan suggestive of malignancy are solid cystic appearance, septations, bilaterality, intra-abdominal nodules, presence of ascites or free fluid. CT scan is conducted if malignancy is strongly suspected, as it can help to assess for the presence of metastasis or lymph node involvement. If a malignant ovarian mass is suspected, serum tumor markers may be of some value in the initial assessment. However, they are neither very sensitive nor specific and should only be used as a guide to management. The following are the markers and what they can signify. In this video, we will discuss about management of benign ovarian tumors. Ovarian tumors or neoplasms may be broadly classified as 1. Benign, 2. Malignant. Benign ovarian tumors can be further classified as physiological, example, follicular cysts, corpus luteum cysts, or pathological, example, endometriotic cysts, benign cystadenoma. Benign ovarian cysts are far commoner than ovarian malignancies. Their size can vary tremendously from a few centimeters to sizes large enough to fill the entire abdominal cavity. They may be unilateral or bilateral, and the majority are cystic tumors. Observation, especially when the cysts are smaller than 5 centimeters in diameter, and the physiological cysts will tend to resolve spontaneously. Surgical options include cystectomy, which preserves the normal ovarian tissue and uterus, salpingo-oophorectomy, which preserves the uterus, contralateral tube and ovary, or total hysterectomy and bilateral salpingo-oophorectomy, especially in postmenopausal women. Ovarian malignancies form the 5th most frequent cancers in female in Singapore. Further management will be discussed in respective videos. Thank you for watching this video. This video is presented by Yong Lu Lin School of Medicine's Department of Obstetrics and Gynecology. For more videos like this, head on to the National University of Singapore's website.